Okay, here we go. Hello, everyone, and welcome to the live recording of a podcast session about the current state of chatbots and AI. We've seen no shortage of impressive use cases with ChatGPT since the end of November and then in December, when Google also unveiled their own medicine focused solution called MedPalm. So, the aim of this discussion today is to clarify the state of natural language processing in healthcare and maybe separate what is still currently in the idea stage from what's already in practical use and where is this field developing. I would like to give a warm welcome to our today's speakers. Alexandre Lebrun, the CEO of Nabla, and Israel Krush, CEO of Hyro. And just as a quick warm-up question, Alex and Israel, can you very briefly describe what your companies do, so we will have that idea in our hands?
Sure. So thanks for your invitation. So I'm Alex Lebrun, CEO of Nabla. So Nabla is creating an AI-based medical assistant that makes healthcare professionals more efficient. So for instance, it would automate clinical documentation or patient engagement, things that, most physicians don't like to do and waste a lot of time on. And so at Nabla, we are applying some technologies that we had worked before at Facebook AI Research for 4 years. So Facebook acquired my previous startup with .ai in the conversational AI space. And before that, I had a first startup called Virtuos in doing chatbots for customer service that was acquired by Nuance in 2012. So this is how we came to building what we do today.
Thank you, Alex. How about Hyro, Israel?
Yeah, so hi everyone. Thank you for inviting me. Israel from Israel, the co-founder and CEO of Hyro. At Hyro, we enable large organizations that are information heavy to deploy and maintain virtual AI assistants at ease. By virtual AI assistants, I mean any type of conversational interface, whether it's chatbots on websites, mobile applications, or voice assistants on a call center. We do it in a quite a unique way, which is intentless, which potentially we'll talk about afterwards. But the idea is really to simplify or make it as easy, as simple, as fast as possible to deploy and maintain virtual AI assistants without predefining intents.
Okay. We will mention a little bit further what each of the company does. But first, ChatGPT is all the rage. Clinicians in the US tested it for writing insurance payments claims that would justify a procedure they did on a patient. Promises and use cases of chatbots like this include the summarization of healthcare records to get a short overview of patients' medical history, diagnostics propositions to simplify jargon-dense reports. Research even says that this AI tool achieved over 50% in one of the most difficult standardized tests in medicine. That's the US medical licensing exam. And ChatGPT was also recently included as a co-author of a peer-reviewed paper. So what else did you see being tested with ChatGPT in healthcare?
Happy to...
Alex, maybe you can... Okay, go ahead, Israel. Sorry.
Sure. So I think that ChatGPT today is the sandbox for all humanity, and regarding like what are the conversational AI capabilities. What a lot of people are astonished by, and for a good reason, is the human-like nature of ChatGPT. So how it actually constructs the answers that it replies based on the world data that was trained pre to 2021. When it comes to healthcare, obviously we have a lot of data, as you've mentioned, around healthcare procedures and claims and symptom checking or triaging that ChatGPT, while with all of the disclaimers that it will give you at the beginning, you can actually get an answer that might sound really convincing. Not all of the time while it sounds or being convincing is actually accurate. So I think that the issues with accuracy with ChatGPT is something that people still don't quite understand a lot. When it comes to other type of usage that I've seen regarding healthcare and the use of ChatGPT, so you talked about summarization of medical records, but I would say that any type of summarization, not necessarily medical records, so even research papers that are related, more conditions, symptoms, diseases to be explained easily. That's something that we've seen being used by ChatGPT. Given the human-like nature of their answers, it can be also used for becoming like a buddy for you. So in mental health, not to diagnose or help with mental diseases, but actually being your buddy or friend to have conversations about everything in the world, something that a lot of startups in the mental health space are currently testing with or without ChatGPT. Understanding more dietary and allergy even restrictions, and that gets to maybe I would say a broader topic of answering frequently asked questions or general questions about the world's data. So it can come from like a dietary or allergy restriction, but when you think about a healthcare scenario, we deal a lot with administrative type of use cases. Some of them require information about the hospital or the clinics themselves. So it can be from opening hours to parking arrangements. So any type of frequently asked question that is related to the service providers in the healthcare world.
Alex, do you have anything to add? Is there something that you saw that either surprised you or you thought was interesting in terms of what people in healthcare tested ChatGPT for?
So first, at a meta level, I think the really new thing that ChatGPT and GPT-3 brought is the how it's easy to test a new thing, to do a minimal viable product. Just to, if you have an idea of automating something, you can really, and you have no data, you have nothing, you can still do something with ChatGPT. It will be wrong sometimes, but it will be enough for like physicians, for instance, to project themselves using your future product, and you can find out if it's valuable and if it's worth investigating more. And before large language models, if you want to do that, of course you can use machine learning models, but you still need a minimal amount of data to train the first version. Before that, there is nothing to try, nothing to test for your users, for healthcare professionals, for instance. And now with zero data, you can do that. So this easiness to do prototypes and MVPs is absolutely makes a huge difference, I think, and will accelerate the production of new things on the market. And then for healthcare applications, I think Israel did a good job to summarize, lots of things that are very interesting. I especially concur on the coach / patient education side. Every time you need to spend a lot of time with chatting with patients, maybe for lifestyle changes, for behavioral changes, moral support. This is very efficient for that, very convincing. It's also really good at automating many administrative tasks, and it will get better at that in the coming months, I think. The one area where I think we shouldn't use it for now is checking symptoms or doing any kind of diagnostics, because sometimes it's wrong, but as Israel mentioned, it's very confident and the form is always really good. So it's easy it has a lot of confidence, and it can say something wrong but the form is perfect, and it's very dangerous. And so this is I think a very important area where we would like to use AI, but ChatGPT hasn't made the difference yet.
Israel, in one of the blog posts on the Hyro website, I thought one thing that was mentioned was very insightful, and that is that conversational AI doesn't necessarily correlate with chatbots. So you can have chatbots that are not based on conversational AI. Can you clarify that difference? So when does a chatbot use AI and when not? And maybe we can also talk a little bit more about what are the differences between symptom checkers, because we know that there are a lot of players in the field, and what we now see with ChatGPT.
Yeah, so regarding conversational AI and chatbot, so basically, if to summarize it in one sentence, conversational AI can or might not power chatbots. So chatbots is just one application, a text-based interface that can be on your website, on your mobile app, on the social networks, that is related on text, and it may use or may not use conversational AI. By using conversational AI, it means that there are some heuristics or models that have been trained on NLP technologies, whether it's ML, deep learning type of technologies, whether it's computational linguistics type of technologies, the use of knowledge graphs, the use of speech-to-text techniques that are more advanced. Whereas chatbots don't necessarily need to use them. So if you think about V1 of chatbots and we think about the hype that was around them back in, like, I don't know, 2013 to 2017, most of them were rule-based. So they call it chatbots, but in reality, they were more like clickbots. So you had a different graphical user interface where you have a bunch of suggestion buttons, and you basically try to navigate the end user to a specific outcome. And everything that you say that is outside of the workflows that were predefined, you would get a misunderstanding, or I'm sorry, can you rephrase? Sometimes even like these chatbots interfaces, they blocked the chat window, so you can only press specific buttons. And I think that the failure of a lot of these type of applications before conversational AI really became a thing, before the large language models became a thing, before we were able to deal with context in a meaningful way, that created a lot of hype and then a lot of disappointment. And now we are seeing, I would say, a bunch of chatbots that are powered by conversational AI, or other interfaces such as voice assistants that are powered by conversational AI, that are much more sophisticated. Even if they are based on some intents, it's not like it's a completely rule-based approach. They have some learning or inference based on very large statistical models, or understanding of how language is being composed. But I would say that the main difference is that a lot of the time the answer isn't necessarily deterministic, meaning it would be hard for you to really understand or explain to the customer how did we get there, how did the AI answer the question. And that's a huge difference, I would say, between these two.
Alex, do you have anything to add?
Yeah, I think the fact that there are two worlds: the world of rule-based chatbots and the world of more LLM, large language model-based chatbots, or conversational AI systems. And we would like the best of both worlds, but it doesn't exist quite yet. So rule-based, at least, is deterministic. You know that if these conditions are met, it will answer this, and it won't make something illegal or embarrassing for your users or customers, which in healthcare is still more important than in other industries. And on the other hand, but these chatbots, rule-based, if you happen to go outside their rules, they don't know anything, they are very dumb, and they are more like clickbots, as Israel mentioned. On the second world, the other world is these new LLM-based chatbots, very strong at having conversation, anything you want, very conversational. They have something like sounds like common sense, but not deterministic, which can be a big problem for your business. And so I think somebody will eventually manage to take the better of both, and it will be incredible. But definitely the fact that it's not deterministic is a big problem. My first company, we sold chatbots. It's very interesting. Our clients in Europe, so sometimes they make mistakes and they are not fully deterministic. Our customers in Europe, they don't really care if sometimes a chatbot is wrong, if they think it's funny. But as soon as we started to move into the US and sell to US customers, AT&T, Coca-Cola, companies like that, they were so afraid because one mistake can mean a $10 million judgment. If, for instance, the chatbot says something really wrong and embarrassing for the company, so you cannot have live with non-deterministic things. So this is the issue.
You mentioned that we can expect the two approaches to merge, so rule-based with AI chatbots. Can you maybe offer a little bit of a reflection of how did you react when the news about ChatGPT and then MedPalm came out? For most people, we just didn't follow the development of the field closely, but you do, you follow the advancements on a daily basis. So was this something that surprised you? Was it not impressive to you? What does the release of these solutions mean for your companies? And Alex, maybe you can start this time.
So ChatGPT was not a big surprise because we had been using GPT-3 for a while, and it's just like a fine-tuning of GPT-3 for the chat communication mode. And the most surprising was how, the noise it made, and everybody suddenly, even like yesterday in France on the main newspaper, like popular newspaper, like equivalent of USA Today, on the first page was a huge article on the secret of ChatGPT. It's the first time ever I see this. Normally this newspaper, which is called The Parisian, is more about the last soccer game or things like that. And half of the first page was about ChatGPTs. So the most surprising to us was when GPT-3 was out, nobody outside the machine learning circles or engineering circles and hacker news, and nobody talked about it. But now my parents are calling me to ask me about ChatGPT because they want to know. So this is the biggest surprise. And before that, GPT-3 was incredibly powerful, but there were previous, GPT-2 before that, and it started with BERT a few years back. So I think the progression of large language models was we could expect it, but the reaction of the world for ChatGPT is incredible.
Israel? Yeah, I agree. I think that, so first, when ChatGPT came out, we just moved to a new office, and I had to give a speech, regarding the new office, and I've asked ChatGPT to write the speech for me. And I think that I've used this technique when I actually made the speech, and I fine-tuned it, like I've said it, make it more exciting, make it less formal, so it will actually be more like my style. Thanks the spouses of the employees and so on and so forth, and they actually presented quite a good result. And I think that for me it was a moment to emphasize to the entire company that, okay, we are tracking LLMs and we are tracking conversational AI for quite a time now, but this, to Alex's point, is a significant point in time in which a lot of other outsiders, if you want, will get exposed to the power of this technology today and how it will look like in the future. So it might present risks in terms of a lot of new startups, again, to Alex's points earlier, can create MVPs now. And I believe that this release is, I don't know, we'll need to see how it plays out. But it has the potential to be like AWS for the NLP world, for the conversational AI world.
Yeah.
So AWS, before that, like you should have had like a bunch of people that know hardware and build like servers in specific rooms and wire and so on and so forth. And all of a sudden, everything is in the cloud and it's in a click of a button. So not the exact equivalent, but somehow similar in terms of like how easy it is today to start an NLP company. It might not be a good NLP company, might not be a business-worthy NLP company, but the amount of incumbents that I'm expect us to get into this category in the next couple of years is great. And I wanted to make sure that the entire company understands that while these are the risks, there is also a lot of opportunity. There is a lot of opportunity because we are already funded. We already have customers. We conduct tens of millions of conversations and messages with these customers. We have our own unique data sets. LLM is just one part of what it takes to build a good conversational AI platform. It's a lot about the orchestration and how the different parts, like the speech to text, plays with the LLM, plays with the context that you handle. And I decided to look at the opportunity. How can we leverage the advancement in our field to make our assistants much better and to make sure that it actually creates more opportunity than a risk for us?
Going maybe from all the media reports to your observations and expert assessments, so on 11th December, Sam Altman, the CEO and founder of OpenAI, tweeted that, I quote, ChatGPT is incredibly limited, but good enough at some things to create a misleading impression of greatness. It's a mistake to be relying on it for anything important right now. It's a preview of progress. We have lots of work to do on the robustness and truthfulness. So I want to stop here for a little bit. Alex, you mentioned earlier that you would not use this tool for, say, diagnostics. So where do you see the current reliability of these solutions? To which extent do you think that maybe, I don't know, they are actually very highly reliable, but, the CEO of such a company as OpenAI can make a disclaimer as a protection towards any lawsuits or something like that?
No, I think Sam is honest, protecting against lawsuits, but also it's his true opinion. ChatGPT is not reliable at all. It makes mistakes, makes hallucinations, and the danger is, as we said, it is so confident, and the language is so perfect that these hallucinations are well hidden and very hard to catch if you read quickly. And so this is very dangerous. When ChatGPT is wrong, as everybody knows, if you've tried it, it's not like suddenly the language is wrong language. It's that the meaning, the deep meaning or the deep reasoning is not right, and it takes concentration and detailed reading to find these mistakes. And so I think it cannot be used as is today. Maybe for SEO, like not content generation, where you don't care if there is a mistake in the middle. Of course, this is the first application of these things, but it still require, as Israel said, a lot of work before you can use it. So I think today, if you really want to use it, it should be supervised. So it should suggest things that will be approved by a human operator or the user themselves. But then if you want to apply them for an actual task, you need to, I think the solution will be to have another model, machine learning model that is not based on GPT-3 or ChatGPT, and that is trying to classify the trustworthiness of each output of the GPT-3 model, you see what I mean? So a kind of supervision by another model. And so there is a lot to do, having having a nice MVP, a nice prototype or demo that you use to raise your seed around is one thing. Having a product on the field is even if the first thing looks like 90% complete, the last 10% is a huge work in terms of fine-tuning, security, explainability, integration and real world product. You need to build a product on top of that. And so I think this is where what startups will do now, that they won't have, they will have to spend less time on the core model, but more time on all these things on top of it. Like AWS, as Israel mentioned.
Israel, I'm sure you have a comment there, and maybe you can add to that. How do you then work with the customers when it comes to fine tuning? Do you work on a customer basis, basically, with the experts from the organization that you work with to really fine tune the models that you use to a specific use case?
Yeah, so I think that something that we constantly educate our customers, partners, is around this trade-off between how easy it is to deploy and maintain your solutions, your conversational AI, to how much control do you have on top of them. So, for example, let's say that we create an app where we direct all the traffic to GPT-3, right? And it answers without any supervision. So it sounds like it's plug and play. It's very, very easy to do, but the organization can't really control the output. And if it can control the output, it has a massive issue, especially if it's an enterprise customer, especially if it's in the healthcare industry. So I think that we're constantly asking ourselves and our customers, what is the right balance between, on the one hand, we want to make it as simple, as fast, as easy for you to deploy virtual AI assistants for various use cases. On the other hand, you really want to control the output. You really want to make sure that you don't provide misinformation. You really want to have a full testing experience before you release it out there. You want explainability of AI. And I think for a lot of these issues, just tackling or plugging in ChatGPT won't really work. Now, what we do today is we use ChatGPT or other, GPT-3 or other large language models to specific uses, mostly not, by the way, in terms of full understanding or full inference. So I'll give you an example. We rely heavily on them to extract specific entities. So they are very good at name entity detection, getting a sentence and understanding the name of an entity or a location. So these are specific tasks that we might use either machine learning models or these large language models. Another thing that apparently they're very good at, and we talked about it, is sound more human-like. So we were very much focused around goal completion. How can we help the maximum amount of users, of patients, for example, to complete their goals, whether it's a scheduling procedure or whether it's an information request. And we were less focused around making the natural language generation, the response, more human-like. So if you give even you can try it on ChatGPT, a bot response and tell them, make it more human-like, it's actually provide a very interesting results and a better customer experience if you want. So we try to use LLMs in general to augment some of the experience where we are taking full responsibility on the actual response that we generate. So we use them in parts. We might use them to make it more human-like. We might use them to extract several entities. But at the end of the day, when our customers will ask us why did we get this answer, we'll be able to explain it, and that's based on our tech. So it's really an orchestration issue. That again, I believe that the players that have been in the field and dealt with some of these issues in the past will help a lot. I'll give you maybe one last example. We talked about conversational AI being an omni-channel solution, so not only chat or text-based. So think about a call center operation where you want to automate some of the calls. You can't really reply with this one-page long answer that you get from ChatGPT. So you really need to think about the medium in the sense of how do you actually communicate back to the end user. How long is your answer to be read to the end users? and that's another part of the orchestration that I'm talking about.
I just remembered one thing. Alex, earlier you mentioned that now, your parents are asking you about ChatGPT. This is a question for both of you. So what about your clients? Did they came to you with any questions in a sense of, I'm not sure we even need you anymore now that we can apply this tool. So what did you see in that regard? What kind of feedback did the clients give you, if any?
It's interesting. I don't think they were. I think our clients understand quite well. We train them, and they understand quite well machine learning and what is a large language model, and what works well with ChatGPT and what doesn't work, as we talked about earlier today. So I think they would be worried if we tell them, okay, now we switched, we threw everything away and we switched to ChatGPT entirely, and it's what powers the product now. So they are intrigued, but I don't think they are worried or especially excited other than that.
What about your side, Israel?
I think that again they hear about the buzz like others. I think that they realize that they can't they can't really rely on large language models that were trained on the world's knowledge. I think that there is an understanding that actually smaller models and more domain specific models, I would say even not domain, even customer specific knowledge is something that is much more meaningful. And they are asking us where do we leverage that, and they can add some ideas regarding where can we add it in the future. But I think that they know to make the differentiation between the hype to the actual implementation on ground. It does, I believe, like the hype does create more demand. So a lot of organizations that might thought, well, it will take a couple of decades before we'll get to a level of human-like conversation. Again, ChatGPT is very human-like, even though it's not accurate all the time. So I think that that actually might also help drive more businesses and more interest from prospects. I would say that for investors, however, this is really confusing because on the one hand, like generative AI is all the hype at the moment, and everyone are thinking, and Sequoia wrote an article about that, about the next generation of generative AI companies, and so on and so forth. But really like the understanding of differentiation in what it is known as a crowded market as is becomes even more complex for some. So a lot of hype, some confusion, and some opportunity.
We have a few questions from the audience, but just before we address them, I want to perhaps clarify one more thing. So you mentioned large language models. Obviously we're talking about this today, but I want for the audience and for everyone to get an understanding of what large language models actually are. So, and what do they mean in terms of reliability? Where are we with that today? So, because ChatGPT is based on a very broad set of documents and data, whereas MedPalm, which was unveiled by Google, is much more specific for medicine. So MedPalm is actually based on various databases of medical exams, questions posed by the public about healthcare. So it's a very different model in a sense of its specificity. Can you clarify a little bit that difference, between different language models, and how do you when you're designing your solutions, are you strictly focusing on medical inputs for your models?
So I can take this first. So large language models, it's mostly about the number of parameters in the model. So GPT-3 has 175 billion parameters. It's been trained. 60% of the training data comes from Common Crawl. Common Crawl is a data set of 380 terabytes. So it's about 10,000 times the size of Wikipedia English of text found on the web. So you see the scale of what we call large. This is a large language model. And as you know, language model is very, very simple. You give me the first X word of a sentence, and I need to guess the 11th word. So it just tries to complete text word by word or token by token. So it's a very general task. It doesn't know about which language, doesn't know about the industry, doesn't know about the task, the questions we ask, the prompt. It's a very, very general approach. And this is why these large language models can be so generalized and answer questions or do so many different tasks with the right prompts. So when we talk then about things like MedPalm, the number of parameters and the number of the size of the training data is much smaller, but it's more supervised. So the training will involve humans in many cases, maybe not the case of MedPalm, but that actually this is the case for ChatGPT, who we will supervise the answers and reward the system when the answer or the reaction is good. And so this is a smaller data set, smaller number of parameters, but trained for a very specific or more specific task. And I think both are different, both are very interesting. And again, I think a good product should mix with the right heuristic, should maybe use both of these models. For us as startups, it's out of question to train a large language model. We don't have enough compute. We don't have enough. We could have enough data because some of it's public, but we are talking about tens of millions of dollars for each cycle of training. Of course, no startup. Depends if you call OpenAI a startup, but no normal startup can do that. And so we don't have the option to train our large language model, but we can use large language model and work on the prompt, how we prompt them. And on the side, we can fine-tune our own model. Well, we can train our smaller language models, but very specific to our task. And we can also fine-tune mid-size language model to our task. So there are different weapons we can use. But clearly, the game is different now than it was a year ago. Because we have new weapons, new tools, and I think the startups who are learning the faster how to use these things will eventually win the new game.
Israel, do you have anything to add?
Yeah, listen, I completely agree. I think it's about how to use it. So prompts is one. When to use it as part of the orchestration is another. The data that you can actually use to fine tune. So today you can't, or actually you already can in some language models to fine tune is the third one. But yeah, well said.
We have a few questions from the audience. The first from Harvey Castro is, do you see that ChatGPT would be considered by the FDA as a medical device? Who wants to take that one?
Never, ever. Well, if the FDA gives a green light to ChatGPT, then I'd be very surprised. No, ChatGPT is everything the FDA is having nightmares about. It's non-deterministic. Well, somewhere it is, but we don't understand why the output is that. It's very hard to prove. To my knowledge, it's impossible today to prove that ChatGPT will behave or not behave in a certain way in some situations. And so very hard to prove that it won't suddenly advise to a patient to kill themselves, for instance. So I think ChatGPT alone, it will never pass FDA approval or any serious approval. So just in my opinion.
Israel, do you share that opinion? There's quite a lot of AI algorithms that have already been approved by the FDA, and I'm not sure if, for all of them, you can really clearly state how the result came out from the inputs sent to the model.
Yeah, I think that explainability is 100% the big one. But I do agree with you that if you have hard evidence that a specific software or whatever outperforms a human being, and by hard evidence, I mean like statistical evidence that was examined by experts, then it might get there. But I do agree with Alex. Like I don't see that ChatGPT in its current form is anywhere close to it. Some smaller iterations focusing on niche cases that might also be coupled with other technologies, then maybe. If you think about it, like the narrower the problem is, the higher, I would say, chance that they will be approved. But currently it's by its name, right? It's a general model, so I don't think that it will make it. I would also claim that it's like asking whether a specific physician would be FDA approved regarding symptom checking or triaging, because like ask 3 physicians about a complex situation, not an easy one, you'll probably get at least 2 different answers. So I think that this problem by itself is a bit non-deterministic by nature.
You actually opened up an important question that I think is always present when it comes to technology in healthcare and clinical decision support systems, and that is that in clinical practice you have different opinions, you have second opinions, clinicians don't agree, but when it comes to technology we suddenly expect that everything is going to be 100% correct, right?
Yeah, and I think it really depends on the problem or the issue that you're looking at. So, for example, if you're trying to detect cancer by CT scans, X-ray, MRI, then hopefully you actually have a big enough data set when you know the right labeling, meaning like whether this specific scan was there a cancer or wasn't a cancer, and then you can compare what were the observation in real time of physicians versus a machine. Here, I don't think that this is the case, or at least like the labeling would be much harder to do, and also like proving it from a statistical point of view would be much harder to do.
We have quite a few questions and only 15 minutes left, so let's quickly go to the questions in the chat. I hope you can see them. Can you see them, Israel and Alex?
Mm-hmm.
Okay, so let's go to this one. So Matit is asking, is bringing more control to large language models, in your opinion, primarily about using the model to capture human input and forming a query for semi-structured database with checked facts? So how far do you think only providing more human-guided training can get us in terms of reliable large language model outputs? Israel,
I think so.
Yeah, go ahead. Sorry.
No, Matic is right. One way is to train your LLM not to give the straight answer, but to use another system. It could be query structured database, as Matic mentioned. It could be also to use a browser, to go online and fill a form on a website and do something in a structured manner. And this is clearly a new avenue of work, very active these recent months. I think great things will come from that, using the LLM as an operator of another system and not as a system per se. And by the way, it is necessary because LLMs are very static. They are trained every few months or so. But we need dynamic information. Maybe something happened a few seconds ago in my system, and I want my LLM to be aware of that. So the solution for that is not to retrain my LLM every time there is an update in my system, but to train my LLM to go fetch this information wherever it is. So this is one avenue of getting more control on the LLM. Another avenue is to have another model classifying the output of my LLM as something that can be trusted, that is probably right, or at least this model we're trying to explain, to find the source of why the LLM behaved like in this way. So this is another area where we could find interesting solutions to get more control over LLM outputs.
So two quick points on my behalf. One, and that might be like a more bombastic statement. You can think about like how machines talk with machines today. It's through APIs, right? We have a very well-defined API. Now the question is, can we take language and translate it to API and vice versa? And I think that once we do that, that becomes like a very interesting area. So just like tapping into how to create like this query of structured or semi-structured database and this translation back and forth between language and APIs. So that's one. The second thing regarding human guided training, just important to clarify, ChatGPT and a lot of the other applications on top of a large language model have some human feedback in the loop, right? So like specifically ChatGPT was trained with a technique called RLHF, which is reinforcement learning with human feedback. And that's again, like basically, in that case, it was to make it much better in actually preserving context and having like multi-turn type of conversations. So the human feedback was after 5 utterances, for example, unlike like previous training of models of after 1 utterance. So human guided training is already there. Can we get it better? Can we get it more reliable? Absolutely. It might not be as part of the LLM, but actually with other components that behave nicely with the LLM. So again, this orchestration that I've been mentioning quite a lot of time in these conversations. And yeah, they will get better and better.
Additional question that we got from the audience is how well does ChatGPT fare as a translator of medical jargon to plain language that patients could understand, and what are the caveats? Have you any considerations about this?
So LLMs are really good at translation. For instance, Google Palm proved that with just 5 examples, their model is on par with highly specialized systems for English to German translation. So strong without specific training for that I can assume that it should be really good at translating medical language into like normal patient language, because after all, we could see these two things are 2 languages, and the translation task is very well known. So I think it will work quite well. I haven't tried, but I'm quite confident it would be very efficient. The only caveat I see is if there is one mistake and it kills the patient, then it's a big problem. So as usual, in healthcare, it should be great, but hard to make sure no mistake is made.
Anything to add, Israel?
No.
That's it. Okay, another question. Should someone fine-tune ChatGPT on WebMD and create a better interface for that? What would worry you if someone did that? What would excite you?
What do you mean if someone? We're already doing that, or at least like partially. And again, it's not necessarily fine-tuning the large language models, but it's actually using some available sources out there, WebMD being like, for people that don't know, like the Wikipedia, and if you want for healthcare out there, that was still being used by a lot of physicians in the States. Yes, so specialized knowledge is definitely helpful to make conversations that are better for a specific domain or topic, that can improve the accuracy rate. And I think that you can think about it, or at least we think about it in layers. So we talked about the knowledge graph earlier. I think about like three main layers of knowledge, and with different importance. So the most important layer is the customer's data or the customer's knowledge, because this is the most reliable. We know that we are serving a specific customer, and that's what they think, for example, about COVID vaccination. Then you have the second layer, which is might be around a specific domain or an industry. So, for example, what the CDC or what WebMD thinks about the COVID vaccination, and that's the industry or domain layer. And then you have the general layer or the language layer or the world's knowledge layer, which might be Wikipedia or even Reddit. And that's where a lot of the time you get some mistakes. So I think that understanding or prioritizing between these different knowledge layers and being able to first try to get a response from the most accurate one would help a lot. And if you get more and more domain-specific knowledge or even customer-specific knowledge, that will make your assistance much better.
I think we went through all the questions that were in the chat, but since we do have 8 minutes left, I would like to ask you both, what is for you currently the most difficult thing when you are improving your products with large language models?
Very good question. I think in healthcare, the most difficult thing, and not just with large language models, but I think with machine learning models in general, it's very slow and complicated and expensive to get data and also feedback from users. And so, for instance, if I change my model to generate clinical documentation after a consultation, because I cannot attend these consultations, data privacy, it's medical data. It's very difficult to know if what we changed works better or not. So the feedback loop is extremely long and expensive because you need to talk to doctors one by one, or you need to develop some automatic ways to evaluate the quality of the models against a baseline. And in healthcare, because this is a nightmare and it is slow and expensive, especially it's very slow. So for instance, if you generate images like DALL-E, your feedback loop is 1 microsecond, or just discriminates the quality of the image you produce. But in what we do in clinical documentation, for instance, we cannot use things like that, and it's very difficult to get this feedback loop.
Israel?
Yeah, completely agree. On top of that, I think that handling context, so what was being said in previous turns and how you can actually relate to it and have a conversation versus like one-off questions. So preserving context, understanding context switches, being able to respond to context switches, that's one big problem that I would say a lot of conversational AI companies deal with. As well as, again, probably less in text, more in voice, and that's latency and everything related with actually conducting the conversation with potential interruption. So while the assistant is starting to have the reply to the user, and the user all of a sudden stops them and interferes. Also in voice, when you don't have a visual in front of you, then it has to be real time. So everything related with latency is also a struggle, and the combination of these two. So latency and preserving context, so understanding that you are in a very long multi-turn type of a conversation and still being able to respond on point and at a relevant time. These are some of the challenges that we're experiencing.
We actually just got another question, which I think we can take because we have 5 more minutes. So we talked about several use cases of ChatGPT in healthcare, but now if we try to narrow it down, Nadia is asking, what do you think would be the most frequent use case with most potential of ChatGPT in healthcare?
So I don't know if it's going to be the most frequent use, but I think that one obvious use case for me is, again, ChatGPT today is being used by a lot of people in the world as an assistant that helps you ideate and open your creativity. So I think about it in the healthcare realm. If a physician now has a complex issue and he has a bunch of data points and he thinks about specific directions, he won't ask for ChatGPT for the answer or for guidance, but it might use them as a pal, as someone that will open or unblock creativity for him in terms of trying to understand various options that are available. So I think, again, it's less about giving a definitive answer and more about opening blocks and helping with creativity.
On my side, I'm very excited by patient-facing use of ChatGPT and the successors. So, for instance, doing patient education or asynchronous follow-up after a consultation to make sure the treatment is well followed takes a lot of time. It's very expensive. It's a big gap in the healthcare systems. And I think ChatGPT-like systems could be really good at that.
Okay, thank you. We have 3 more minutes, so maybe just one last question. We talked, about the potential, about the positive use case, but what about the negative use cases? For example, if a doctor used ChatGPT to write a claims for the insurance to cover the procedure that was done on a patient, why wouldn't an insurance agent simply use ChatGPT to write a denial of that claim? Where do you see any potential, negative sides of the use of these models?
Everywhere. It's listen, it's going to be a whole new world, and already I think that some governmental entities are starting to think about what is allowed, what is not allowed. Not only governmental, by the way. So also I think like Stack Overflow, which us developers use quite often. They forbidden like ChatGPT answers, and for a good reason. So I think that we will need to, as a society, will need to create like the right balances, or at least how can we deal with basically fake news, fake entities, fake information that becomes much easier to generate.
Alex, anything to
Yeah,
add?
I agree. And it's that, I think all industries and life in general, we have this threat of what can you trust? It's so easy to generate any content. And also we mentioned the risk of mistakes that can be easily done, but well hidden by the systems. So I think these are examples of things we'll have to work on to have industrial applications.
Okay, and with that, I think we can conclude today's session. Alex and Israel, thank you very much for joining this discussion. Sincere thanks also to the audience that took time to tune in and also contribute with their questions. Some people were asking if there's going to be a recording available, and the answer is yes. This is going to be published as a podcast at the end of this week, and I will also write a summary in the monthly newsletter that we publish. I would also like to just take a quick second to thank Matic Bernik and Robert Tovornik, who are the data data scientists at Better with their help for preparing for this session. And yeah, that's it. Thank you, everyone, and have a nice rest of the day.
Thank you.
Thank you.
Bye.